In this extensive conversation, Michael Gross explores the critical role muscle mass and strength training play in addressing some of the most prevalent health crises, including heart disease, cancer, type 2 diabetes, and Alzheimer's disease. The discussion highlights how muscle is not only central to physical strength, but also deeply interconnected with broader health outcomes, longevity, and quality of life. Insights from pioneering research, clinical applications, and historical perspectives shed light on why increased muscular strength is vital across all stages of life, and how society's medical approach has often overlooked this essential connection. The dialogue emphasizes findings from the Baltimore Longitudinal Study on Aging, which reveal that the decline in muscle mass accounts for roughly half of the decrease in aerobic fitness encountered with aging. This challenges the mistaken belief that strength training and aerobic fitness are antagonistic. In fact, they are closely intertwined and mutually beneficial. Muscle mass preservation directly supports aerobic capacity, meaning that strengthening exercises are imperative for maintaining heart health and overall cardiovascular fitness as people age. Research discussed in the podcast shows that strength training alone can reduce cancer mortality by 16%, while aerobic training alone shows no such effect. This is largely attributed to muscle wasting, cancer cachexia, commonly seen in cancer patients, which contributes to increased fatigue, infections, and risk of falls. When strength training is combined with aerobic exercise, cancer mortality risk further drops by approximately 28%. This powerful synergy highlights the need for oncologists to integrate resistance training as a fundamental part of cancer treatment, a practice some experts argue should be considered a Hippocratic imperative due to its impact on survival and quality of life. Muscle mass operates as the body's largest glucose disposal site, making it critical for metabolic health. Long-term research by Maria Fattaroni Singh involving high-intensity resistance training demonstrated significant improvements in glycemic control and insulin sensitivity for overweight and diabetic adults, whereas low-intensity weight training or weight loss alone did not yield comparable benefits. This underscores that how weight is lost, particularly through maintaining or building muscle, is as important as the weight loss itself when managing and potentially reversing type 2 diabetes. Progressive resistance training also proves profoundly effective in mitigating cognitive decline, notably increasing the size of the brain's posterior cingulate cortex, an area critical to empathy and emotional memory and one of the first to atrophy in Alzheimer's. Clinical trials comparing resistance training, cognitive training, and sham exercise found strength training produced the most significant cognitive improvements, particularly mediated by lower body strength. A combination of Mediterranean diet and daily exercise, including strength training, showed a threefold reduction in progression from mild cognitive impairment to Alzheimer's, yielding hope for scalable, population-wide dementia prevention. Michael Gross weaves in insights from classical scholarship, noting that ancient Greeks recognized strength as both a divine gift and a human achievement. This paradoxical view saw strength as inherently interconnected with support from others, symbolized artistically by images such as Hercules, supported by the goddess Athena. This lens of interactive interdependence contrasts with modern individualistic views and offers a more holistic understanding of human capability and identity, shaped through collective effort and persistence. The story of Jan Todd, a trailblazer for women's strength training beginning in the 1970s, exemplifies how building muscle redefines personal identity and self-efficacy. Strength training empowers people by increasing their confidence and ability to interact with their environment effectively, which is key to social connection and psychological well-being. Another example shared was a woman named Jenny McGonigal, who reversed osteopenia and revitalized her life through strength training in later adulthood, demonstrating the potential for transformation and renewed purpose at any age. The conversation highlights practical approaches to strength training in older adults, noting that heavy lifting should be scaled relative to individual capacity and can be safely introduced even in nursing homes. Maria Fattaroni Singh's work showed that frail and elderly people, including those in their 90s, can achieve significant improvements in muscle strength, function, and quality of life through progressive resistance training with proper medical supervision. The importance of personalized, manageable increments, starting at about 50% of one repetition maximum and gradually increasing, ensures older adults build confidence and capability without undue risk. Innovative medical clinics such as the Center for Strong Medicine in Australia and Garland Neurology in the United States integrate strength training into chronic disease management, treating patients with multiple coexisting conditions in geriatric and neurological contexts. These clinics feature gym spaces within medical facilities, emphasize supervised, tailored exercise prescriptions, and illustrate a team-based approach to treating diseases through muscular health. Such models demonstrate the enormous potential for exercise to serve as a primary or adjunctive therapy if integrated systematically within healthcare systems. Gross discusses why strength training has historically been sidelined, rooted in cultural prejudices dating back to ancient Rome, where muscularity was often disparaged by physicians as antithetical to intellect. These biases entrenched divisions between medical and athletic domains, delaying the integration of strength as a critical component of health. Additionally, structural issues such as lack of exercise education in medical schools, inadequate Medicare or insurance reimbursements for exercise physiologists, and inequitable access contribute to social disparities in who benefits from muscle strengthening interventions. The podcast touches on the psychological benefits linked to strength training, primarily through the concept of self-efficacy, the belief in one's ability to carry out actions and achieve goals. Strength training has been shown to enhance this sense of efficacy across ages and genders, crucial not only for physical health, but for emotional resilience and social engagement. Stories shared from individuals who transform their self-image and capabilities through strength underscore the profound mental and emotional effects of muscular development. Michael Gross reflects on how training connects the past, present, and future selves, providing continuity and purpose over time. Drawing inspiration from ancient athletics and literary metaphors, he portrays strength training as a lifelong practice that grounds identity and health amid life's inevitable changes. This viewpoint encourages listeners to adopt muscular strength as a foundational component of a robust and vibrant life, emphasizing the importance of a clear why to sustain commitment even during challenges.